Yay. Welcome to Nutrition Equity, the podcast into the intersection between nutrition, healthcare, and social justice. I'm your host, Joanna, and this week we have an important topic to discuss, the Medical Nutrition Equity Act. Imagine a world where access to essential medical foods, formula, and vitamins is not determined by your zip code or the insurance plan you have. Or a world where patients in conditions like tyrosinemia can have equal and affordable access to the life-saving treatments they need, regardless of their financial situation. This is precisely what the Medical Nutrition Equity Act aims to achieve. The Medical Nutrition Equity Act is a groundbreaking piece of legislation that, although it hasn't passed yet, holds immense potential to transform the lives of countless individuals, like our guest this week, Andrew, who is a tyrosinemia patient. Tyrosinemia is a rare metabolic disorder that requires specialized medical foods and vitamins to manage and maintain health effectively. This proposed bill seeks to mandate healthcare companies to provide coverage and pay for a portion of the cost of medical foods, formula, vitamins nationwide. By doing so, it would significantly reduce the financial burden on patients and families, ensuring they can access the necessary nutrition to lead healthier and more fulfilling lives. In this episode, we will delve into the specifics of the Medical Nutrition Equity Act, the potential impact on patients and families, and challenges it faces on the path to becoming we'll also hear firsthand from Andrew about his journey as tyrosinemia and the obstacles as he has encountered in accessing the vital medical nutrition required to manage his condition. Joining us, we shed light on importance of the nutrition equity and advocate to future where essential medical foods are available to all who need them. So let's get started and make our voices to support the passage of the Medical Nutrition Equity Act. Don't forget to subscribe to Nutrition Equity wherever you get your podcasts, and join each week as we explore the stories, the science, and other policies shaping the world of nutrition healthcare together. Let's strive for a more equitable and healthier future. Let's see. So, welcome to the show. Let's see. Can you tell us about your journey with tyrosinemia and when you were diagnosed to gain so that's where we're. So can you tell us about your journey?
Yes. First off, thanks for having me on the show. And I guess starting off the bat, I guess. I was first diagnosed with tyrosinemia around, I think it was 6 or so months after I was born in the hospital. And at first they didn't know what was wrong with me, the doctors. This was in 2000, September 23rd, 2000 specifically, was when I was born. And at the time, I think the medicine Orfidin, and it was still in its infancy, and there weren't really a lot of people with tyrosinemia at the time. So it took them a long time to figure out what it was. And originally, when I was first in the hospital, and I mean, I was able to go home after I was born, but then my parents started noticing that I wasn't really adjusting well. Like, I had a lot of health issues. What's there, like bloated stomach, internal bleeding, non-stop crying. That's not really a medical issue, but still, it was pain. There was a lot of pure, I guess, just it wasn't pleasant, and it was so bad that, and I'm not making this up. The doctors asked my parents if they were related. That's how sick I was.
Wow.
I think about 6 months later, they found out that I had tyrosinemia, and they got me on Orfidin, which was, I think it was in Scandinavia at that point. They had to ship it over. And after that, I've treated, and so far I've been pretty well.
Mm-hmm. So how have things changed since then?
They're a lot easier. I still take Orfidin. I take it 3 pills in the morning, and I have been taking it every day since I was first diagnosed, I guess. And I've been on it constantly. I've switched. We also have a drink that we have to take. It sort of supplements the tyrosine and phenylalanine amino acids. And now I'm on this new thing called Sphere, which I actually have it. I can go grab it real quick. I'll be right back. It's sort of the same. It's sort of similar to the Tyros powder, I guess, the original one. It's a little different. Still need to finish it. It's a lot less of a dosage. Basically, I do it twice a day. I think it's 2. One cup and 2 things of powder. That's the medicine part. The other part is just eating healthy, staying on the diet, not eating meat, cheese, high protein stuff.
So how does tyrosinemia differ from PKU?
I don't entirely know, if I'm being completely honest. I know that PKU, they have a cure right now, and tyrosinemia, we are working on getting one, I believe. It's in the development. I don't particularly, I'm sorry, I can't answer that question.
Yeah. I didn't know that they had it. I didn't know they had a cure right now.
Yeah, for PKU, I think, I don't know when they got it. I remember hearing about it back in 2014. And tyrosinemia, they're working on it right now. It should be out next year, I think. I think.
Yeah, I just know you have some of the same. You also have phenylalanine, though, that you have to watch out for.
That might be the difference right there, I think, if I remember correctly. It's that tyrosinemia affects PKU, it affects phenylalanine and tyrosine, but I think PKU is just phenylalanine, but I'm not entirely sure about that.
Mm-hmm. So did you have any cognitive issues growing up?
Well, they told me that I have a learning disability of sorts, and I've always had ADHD. had ADHD. I'm medicated for it. And if I don't take the medication, then I'm really wigged out. I also get really hungry when I don't take my ADHD meds, and I'm all over the place. So I try to take it so I can focus and, just be calm, I guess. But
did you know anyone growing up with it, or when did you first get to meet people?
I'd say when I was 13, I once went to this camp in Texas. It's like, I forget where in Texas, but it was sort of like a low protein camp. I think it was a PKU specific camp. And I met a guy who had tyrosinemia, but we didn't really talk much. I tried to talk with him. He was very quiet. He never really talked much himself, and I lost contact with him. But then in 2016, I met the group NOTA, Network of Tyrosinemia Advocates, and we found out that they go on trips, and me and my mother and I, we met. It was an Austin conference in Austin, Texas, and we got to meet John Miller, the head of NOTA, and a bunch of other kids with tyrosinemia.
Yeah, I noticed your mother is part of NOTA now.
She is.
Let's see. How has tyrosinemia affected your daily life overall and overall health?
Oh, wow. Yes, pretty significantly, I'd say. In the past, it was harder. Like, I was always upset that I had to drink the Tyros powder every time. And, another thing about the Tyros powder, it was really helpful. It was just, I remember once in kindergarten, I accidentally left it out in the sun, and when it gets warm, it's supposed to be like a milk sort of deal, like you put it in your cereal, or it's like a protein shake, kind of like this is a protein shake. But one time I left it out in the sun, and when you first make it cold, it's white. But I left it in the sun and it turned yellow, and I tasted it, and it was honestly one of the most disgusting things I've ever tasted. It was very rancid, and it made me cry, and I was very upset by it. So that was one part. Also, just growing up with the other kids and, having special lunches, and, whenever they had birthdays, they would get special, like, brownies or something for me. And a lot of the kids making fun of me for, I guess, eating low protein foods, but kids can be cruel. Nowadays, I've come to terms with it. I've more so accepted it. I guess one other part, like having to take the protein powder every time has always kind of been, it's been difficult, and a lot of the other tyrosinemia kids agree with me. That is difficult to maintain it because it's not great tasting sometimes, and it's a hassle, and we just don't want to take it all that much. And bringing it on the airplanes is a bit of a hassle too, because now you can't. I guess there's you can't bring liquids or something, and they always have to stop us and search. And it's just it's not anything bad. It's just medicine, but whatever.
Do they have the pills for you?
Oh yeah, I still take the Orfadin pills. I bring them everywhere. I take a lot of pills, so
I mean the microtabs. Do they have that for tyrosinemia? Like they do for all the other conditions, I know they have them for MSUD and PKU, HCU.
Microtabs. All I really have are the tablet pills.
Yeah.
The capsules.
Mm-hmm.
Yeah, no, I have to take those, and I have to take this.
Oh.
And those are easy, at least for me. I just take them every morning, no problem.
Yeah. I know with the formula, the ones that are supposed to be sub for formula, you take like 16 of them.
Oh, well, yes, those pills, yeah, I tried those once. That was supposed to replace this. I tried doing that over the pandemic, and I just couldn't do it because I already have a ton of other medications, and they were big pills. They were what me and my mother and we described them as horse pills.
Yeah.
So.
Could you share some of the challenges you faced in managing your condition, especially concerning access to medical foods and medical foods, formula, and vitamins? So.
I guess when I was younger, the main low protein food distributor, Cambrook, which is located in Massachusetts, they would make low protein foods, and myself and a bunch of the other Tyrosinemia kids always thought they were kind of gross tasting. Way back in the day, they're better now, but back in the day they were like really, really, really gross. And managing my disorder in general, typically a lot of other people who I had met when I first met a bunch of Tyrosinemia kids at the conference in Austin back in 2016. It was me and one other guy who were actually cognitively aware or present. But for Tyrosinemia sufferers, for lack of a better term, if we go off of our meds and we don't we don't stay on the diet, it basically gives us all kinds of medical issues, or it amplifies them, like it'll delay our cognition way more. It basically giving us a brain fog there, and it could go into kidney failure, seizures, blindness, etc. I've never had to deal with any of that because I've always stayed on the diet. But looking at those other kids and just how dull, for lack of a better term, again, they just didn't look like they were all there. And I just thought, oh my gosh, it scared me. So I've always done my best at staying on the diet. And over the years, because I have stayed on the diet, I've actually been able to eat higher protein stuff because I've got I've been getting older, I've been getting bigger. And because I've stayed on the diet, I've been allowed to eat more foods because I guess I don't particularly know why, but I think it's just because I've gotten older and kept my liver healthy. So.
Let's see. The Medical Nutrition Equity Act aims to improve access to essential medical foods for patients like you. From your personal experience, how do you think this legislation would positively impact the individuals with tyrosinemia?
Well, not all the people who are affected by tyrosinemia have access to insurance, which is a godsend in terms of paying for the medication. I don't know the exact number, but I've been told that if I didn't have insurance, my tyrosinemia medication would basically be unaffordable. I want to say it's like $10,000 a month or something. I'm not entirely sure. It's up there. It's like it's ridiculously expensive. So I feel like this act in particular, I think it would help a lot of people get access to medicine properly, if I'm understanding it as such.
Does Texas cover any of it? Any of the formula food?
Oh yeah. I believe I have some form of Medicare or something. It's some maybe it's United and then it's something else. So they basically cover it entirely.
How do you think greater awareness and about rare medical disorders like tyrosinemia can help in advancing the policies in support of patients like you and like yourself?
I guess if more people are aware of our conditions and how they affect us, then they would be more likely to help us find medical advances in them, I guess, if I'm understanding the question correctly.
Mm-hmm. Are there any personal stories or instances where improved access to medical nutrition would have a significant difference in your health journey?
Well, I feel like if I'd gotten access to medicine earlier in my life, maybe my liver could have been healthier. I know there's this one guy with my disorder who was basically, I guess he had access to treatment pretty much when he was born, like right when he was born. For me, it was 6 months later, and I still had to basically suffer through a lot of the physical pain of the disorder, untreated. So I feel like had I gotten it earlier, maybe I could have been better off in general. But it is what it is, I guess. I'm just grateful to be alive, but at the same time, I think, man, it would have been nice to have had that earlier, possibly.
Yeah, from what you've gone through, because your mother was talking about that, that sounds kind of scary.
Oh, definitely.
Yeah. Let's see. As an advocate for nutrition equity, what messages would you like to convey to policymakers, health care providers, and the general public about the importance of accessible medical foods for patients with rare conditions?
I think that certain medications shouldn't be charged, or you shouldn't charge people so much for certain medications. I would like to believe in a world where it could be free, but at the same time, I consider myself a bit of a realist in the sense that, yeah, the people who are making these meds should get some form of compensation, but considering how expensive the medications for tyrosinemia are without insurance, then if one were to successfully pay them off, they would basically be living under a bridge. That is how expensive it is, and I think it needs to be reduced. And I think a way that one could, I think one way legislators could be inspired to lower the prices would just be to hear us out and hear our stories. And I mean, I don't remember everything from the 6 months prior to me being treated, but from what my mother has described it as, it was really, really, really bad. It was essentially a liver failure, and I was like unnaturally sick. So if more stories are like that were introduced to the public, I guess, or talked about more so, then maybe legislators would be more willing to, give us a little slack on that. And there are a lot of other kids out there who don't have access to insurance and they just don't get medicine and they're basically stuck with these issues. So, part of it is sticking to the diet, which one could do regardless of medication. Like it's pretty simple to just stick on the diet, but without the meds, they're still going to be very, very sick. And the same vice versa. They could have the meds but they could still go off diet and that'll mess them up. Or they could have neither. They could be off diet and they could not have access to meds, and they'll still basically they'll die or they'll get really, really sick. So I think that access to medicine should be more accessible, and the fact it isn't is just kind of ridiculous.
Mm-hmm. So, where do This is one I thought to ask before, and it's kind of off topic, but what's the normal level for tyrosinemia?
Normal level?
As in with blood, when you do your when you do blood draws?
Oh, like the tyrosine level?
Yeah.
I don't know the exact number. I want to say like 500 or 500, 400, 600 level, something like that. All I know for sure is that my entire life I've always been right on the mark. Apparently last time I went, I was under level, which that was surprising to me because that summer or that whole year I hadn't really been eating super well. But yeah, I was still shocked by it, so I don't know. I think that's the right level, though. All I really remember for sure is that I was just on track.
Mm-hmm. So, as we come to the end of the episode of Nutrition Equity, I want to extend my heartfelt gratitude to our guest, Andrew, for sharing an inspiring and insightful journey with us. Your courage and resilience in navigating the challenges of tyrosinemia and advocating for nutrition equity are truly commendable. The Medical Nutrition Equity Act represents a beacon of hope for individuals like Andrew and countless others together and advocate. All of us together can advocate for more and just and inclusive healthcare system, where access to essential medical foods is a right, not a privilege. Remember, change starts with awareness and understanding. I encourage you all to stay informed about the Medical Nutrition Equity Act and similar initiatives to raise your awareness, to raise your voice in support of policies and promote nutrition equity for every individual, regardless of their health condition, financial means. On that note, you can go to nutritionequity.org. Where you can write your story. If you have one of the covered conditions, you can also go to there to write Congress. We are currently looking for a House Republican to reintroduce. If you've been moved by Andrew's story and feel passionate about the cause, share the podcast with your friends, family, and colleagues. The more we spread the word, the stronger our collective impact will be. Don't forget to subscribe to Nutrition Equity so you won't miss any future podcast, any future episodes. We have more captivating stories and expert interviews and policy discussions coming up for a focused, creative on healthier, fairer world. Thank you for joining us on our journey this time. Until next time, let us continue to work towards a future where no one is left behind in access to essential medical nutrition. They need to lead a healthier and happier lives. Remember, together we can achieve nutrition equity and make a difference in lives of millions. Keep advocating, keep caring, and keep striving for a more healthy tomorrow. Stay safe and well. Also, just to you can subscribe to my channel, which is I am a Rare Chef. It's rare_chef on YouTube. I know you also have a channel.
Yes. I have a channel. It's called the Red Mensch. I just make videos occasionally. I'd also like to quickly shout out two of my good friends, if I might, or two really good friends of mine, Unlimited Morganic on YouTube and Super Smash Hunter, also on YouTube. Check them out.
And this should be all over, not on all podcasting stations because I have a ton of them, but all over social media. And I normally turn these into a bunch of shorts also, for those who don't have a whole lot of time. This is Joanna signing off, and see you next time. So see you next week on Nutrition Equity.